Rachel, thank you very much for coming to speak at our Irish Association for Emergency Medicine meeting this morning in Dublin. You've just delivered a fantastic talk about patient advocacy and how you coped in the recent tribulations in the NHS. Can you take me through some of the key points of your talk and some of the learning points that you found?
Yes, so I'm really thrilled to be here today talking at the Association's conference, because I believe that in all healthcare services everywhere, England, Ireland, across the world, actually part of our duty as doctors is that of speaking out on behalf of our patients. A good doctor, I think, is an advocate, because patients are vulnerable. They often don't have much power or voice or status or wealth in society, and we as doctors need to and can have the tools to speak out on their behalf. We all know that understaffing, under-resourcing, lack of beds, lack of funds is a real problem in Ireland, in England, in many healthcare services. And if we speak out about that as clinicians, if we tell it like it is, then we're doing a public service. We're holding politicians to account and maybe making conditions better for patients as a consequence, and I think that's really important for all doctors. I wanted to convey the message that all of us can do this. Nobody's voice is silenced in a democracy without their consent. We can all speak out if we choose to, and actually it's not a reckless or risky thing to do, it's the right thing to do, because the price of not speaking out and allowing conditions to flourish of understaffing is putting patients at risk. So we all need to confront that.
Thank you, Rachel. I think you've given us some very strong and powerful messages to go home with and take home, when you face into a difficult day, like you say. Thank you very much for coming over to talk to us. Thanks.
Thank you.